morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery with me, Dr. Stanley Aruyalu. We've spoken about how to prepare the patient for surgery. There's something we've not mentioned, and this something is controversial depending on which culture you come from. I remember this scenario where I had a case and I told the patient, do not eat because we need to go to surgery. And then the relatives sneaked in with some goat soup and some herbal medication, and they told the patient to feed on that because, according to them, that was not food. That was some medicine, and that was a good wish spell so that the patient would recover from surgery. Now that was dangerous. So let's talk about fasting, or what we call nail per oral or nail per os, nail by mouth. Nothing before you go through surgery. First disclaimer, this only applies in scheduled surgery. If you are going for a life-saving emergency surgery, there's no need to wait. There's no need to discuss when did you last eat. Don't eat for the next so long because you have to scoop and run and save a life. But the reason behind ensuring that patients do not eat anything before surgery is so that their stomach is empty. Because what happens the moment the patient has been put to anesthesia, what we call the cardiac sphincter or the lower esophageal sphincter, that stopcock that prevents food from coming out of the stomach up into the chest, is relaxed because of the general anesthetic. Then as the anesthetist puts some breathing tube down the patient's throat, the patient has this called gagging reflex. They feel like throwing up. Now you feel like throwing up and you can't hold because that stopcock of the cardiac sphincter is now relaxed because of the general anesthetic, and then there you go. The patient vomits. And when they vomit, they are likely to easily choke on their vomit. That is the philosophy behind having patients eat nothing before surgery. Now, depending on what the patient has eaten, we have guidelines on how many hours you should stay so that by the time all these potential things are happening, your stomach is empty. You feel like vomiting, there is nothing. And let's start with solid food. Ugali, githeri, 6 hours minimum. Next, the very controversial. I just took a cup of milk. Non-human milk, 6 hours. Infant formula, none, 6 hours. Breast milk, the child can wait 4 hours after breastfeeding. And finally, clear fluids. By clear fluids, I don't mean tea. I mean strong tea. I mean apple juice. I mean sodas. Anything that does not have particles. Any clear fluid that does not have particles. And of course, a lot of water. If you have taken all these, then we must wait for 2 hours. 2 hours before the patient can proceed to surgery. Generally, that is how we clear them. Solids, non-human milk, infant formula, breast milk, and clear fluids, in that order. But the most important thing to say is if you think you've taken something, it is important to share with your doctor, even if you fear they might cancel your surgery, because it's important that they know than hiding behind and saying you have not taken anything, whatever you have taken is medication. It is important that the patient fasts before they are put under the anesthesia.